Good day everyone, I am Hannah Joy O. Lorenzo, student nurse from ISU Echaga Main Campus, BSN 1-2, and today I will be performing a written demonstration on the assessment of head and neck. But prior to the procedure, I have to first perform proper hygiene and put PPE if necessary. Okay, so after that, I have to gather all the equipments needed. And this includes gloves, pen light, a glass of water, and a stethoscope. Then explain the procedure to the patient. Okay, so good day ma'am. I am Hannah Joy O. Lorenzo, your student nurse for today. So, for verification ma'am, can you kindly confirm your name, your age, and your birthday?
My name is Natalie Hakusalem and I'm 12 years old. My birthday is April 14.
Okay, so how do you want me to call you ma'am?
Just call me Natalie.
Okay, so Ma'am Natalie, I am here to assess your head and neck. And to be able to assess those parts, can I ask your consent? Is it okay with you to touch your head and neck? Okay, so we do this to ensure that everything is normal, and if we find any unusual findings or developing illnesses, we can focus on it and treat it immediately. So I assure you ma'am that everything I gather here will be kept completely confidential between you, me, and the attending physician. Okay? Now let's proceed to the assessment. So I'm just going to wear this. Okay, so from time to time, ma'am, I'm going to give you simple commands and you just have to follow them. Don't worry because the commands are just easy. Okay, so let's start by inspecting your head. Okay, so looking at your head, I see that the size of your head is appropriate to your body, that indicates normal, and we call that as normocephalic. And it is erect, it is in the midline, and the right and left of your head are symmetrical. Now, is it okay to touch your head, ma'am? Okay, so in this case, I am going to palpate your head. Okay, so upon doing the palpation, I assess that there is no lumps, bumps, or any lesions, and I haven't found any masses or any signs of alopecia. Okay. Ma'am, right now I will inspect your face for symmetry, features, um, movements, expression, and skin condition. Okay, so can you sit still, ma'am? Okay, so you just have to follow what I have told you to do so. Okay, so can you raise your eyebrows, ma'am? Okay, lower it now. Can you please blink your eye? And close it tightly. Okay, you can open it now. Next, smile. Okay, so can you please frown, ma'am? Like this. How about puff your cheeks, ma'am? Like this. Okay. Very good, ma'am. So I have seen that your facial features are symmetric and I haven't seen any abnormalities and no drooping that is occurring on your face. Your head is still and upright. Okay, now I will palpate your temporal artery. So allow me to hold your gamma. Okay, so can you please bite your teeth? Okay, release. Bite your teeth again. Oh, release. Okay, now I'll be checking your temporomandibular eye joint. Okay, so can you please open your mouth, ma'am? Okay, close. Do it again. Okay, so do you feel any pain or discomfort when palpating your head? Okay, so I assess that there is no tender with inflammation, and I haven't found any swelling and tenderness, and no clicking when you open your mouth for inspection. Okay, so have you experienced any headaches these past few days? Okay, so that's good to hear, ma'am. So that's all for the head and face assessment. Now let's proceed to the neck assessment. Okay, so I'll be checking your neck, ma'am. So I'll be observing this one. Okay. So I see that your neck is symmetric with head centered and there is no lumps or any masses. Now, can you please sip a small amount of water, ma'am? And just hold it in your mouth and wait for my go signal if you can swallow it already. Okay? Okay, swallow. Okay, so I see that your thyroid and cricoid cartilage move symmetrically upward when you swallow, and that's good. Now, next, ma'am, I'll be inspecting the cervical vertebrae. So, can you flex your neck to the side, this side, and this side? Okay. So, thank you. I don't see any irregularities. So, now I will inspect your neck for range of motion. So, can you please move your chin to this side? This side? Okay. And now, move to this side. Okay. Can you touch your each ears with your shoulders like this? And to this other side. Okay. Look down. And then lift your chin to the ceiling. Okay, so very good. Thank you, ma'am. So, um, do you feel any tenderness doing that? Okay, so that's good. Now, I will palpate your trachea and your thyroid gland. Okay, so I see that your tracheal rings are working. So, can you move your face to the side? Side. Okay, so it's good, ma'am, and your trachea is in the middle, so that's good. And so next, I'll be auscultating your thyroid gland. Okay, so can you inhale, exhale, next, inhale, exhale. Okay, so I assess that there is no broods and your carotid artery is functioning well. So last one, I'll be palpating your lymph nodes. Okay, so first is the preauricular nodes. Next, the postauricular. And the occipital nodes. The tonsillar nodes. The submandibular nodes. the submental nodes, the superficial, okay, so the posterior cervical, the deep cervical tree nodes, and the clavicular. Okay, so that's the last part of your assessment, ma'am. So for the head and neck. So if you have any questions or clarifications, or if you felt anything in your health, so I'll refer you to the attending physician, and so they can explain the things you need to know. So I don't see any abnormalities in your head and neck, and that is great. So thank you, ma'am, for your cooperation. Do you have any questions, ma'am? Okay, so that's all for our assessment. And again, ma'am, thank you.